You're listening to Talk of the Town, the official podcast of the Petal Area Chamber of Commerce, where we highlight local businesses, community leaders, and the stories that shape our city.
I hope if someone says, "What did your mom always say to you?" that one day they'll say, "She told me to be the real deal." We incorporate your health, but we do it with things that you have fun, that women have fun doing. You know, we would love to meet women where they are, but still put the importance of their health in front of them. Leadership to me is not going to be when I'm gone one day,
Right.
oh, look what Millie did. It's going to be, how did those that I worked with lead after I was gone?
That's
I
funny.
didn't even know.
All right. Millie Swan, welcome to Talk of the Town, the very first guest of the Petal Area Chamber of Commerce podcast. So for our listeners, why don't you introduce yourself and share a little bit about who you are?
Okay. Well, I'm excited to be here. I'm excited to be the first guest, and this is my first podcast as well, so we're in this together. Well, I am the Chief Administrative Officer and Vice President at Forrest Health. I'm a Mississippi girl. I grew up in Newton County. I don't know if everyone knows where that is, but Newton County, went to Union High School. Great place. Yay, go Yellow Jackets. And then went to USM and graduated from there and ended up in Hattiesburg, married a Hattiesburg guy and ended up here. So
Wow.
a little bit. I've got 2 girls and 2 grandchildren, Millicent and James, and my youngest is a senior at Ole Miss. So about to be
Wow.
totally empty nest.
Totally grandmother mode.
Yes,
They say
yes.
that's the best.
It is.
When you get to graduate from the parenting mode and go into the grandparent mode,
Very much so.
you're almost there.
My girls always remind me that I was a lot harder on them than I am these grandchildren.
I tell my mother the same thing.
That's okay. We just
Yeah.
have to spoil them a little bit.
Yeah, it's funny you mentioned Newton. A lot of people are not familiar with Newton, but actually, my mother graduated from Decatur High School.
Oh, okay.
So
Very familiar with it.
I was
Yes.
raised going down a dirt road to see my grandfather in Decatur
Yes.
up until he passed, and I'm very familiar with that area. So
Well,
I think it's great.
Yeah, it's
Just
a
country.
great place to grow up. Great people. I still
Yeah.
have a lot of relatives there. So
Yeah.
great childhood memories.
Wow. Well, listen, for those that may not know, and myself included, I'm not extremely familiar with your journey to being where you are at Forrest Health. So why don't you share kind of a brief roadmap of what exactly led you to where you are professionally?
Well, you know, Lindsay, I was going to be the next Jane Pauley. Now, you're a little bit younger than me, so you may not remember Jane Pauley, but she was a female anchor, TV anchor,
Wow.
and she was my idol. And so I was like, I'm going to be the next Jane Pauley. So actually, my journey started as a TV anchor and news reporter, and that was my background, communications, marketing, and so loved that. Well, then when I wasn't going to be able to do that, I ended up marrying a newsman, and so my life changed. We couldn't both be in the business at that time. We did end up actually anchoring together a little bit in the Delta at one time. But anyway, I was very, very close to my grandmother growing up. She was my very best friend. She died at 100 years old. She was
Wow.
quite a strong woman.
Wow.
7 children, so a lot of grandchildren. And so I really had a love for, senior adults. And so when I had to take a little bit of a turn, from my goal in life to be Jane Pauley, then I really started working at an assisted living area in Hattiesburg and was the business manager there with all of these senior adults whom I truly loved and learned so much from them. And so I think that's kind of how I first got a little bit interested, in healthcare. Left from there, went to the Delta. My husband had a management opportunity there at a TV station, and we went to Greenville and stayed 6 years there. And I think God just took my path towards healthcare because I started to work for the King's Daughters Hospital there. Had wonderful experience and cried when I was leaving and coming back to Hattiesburg, but loved Hattiesburg, and so we came back, and I went to work at Forrest General, and the rest is history. 31
Wow.
years later, this will be my 31st year with
What
Forrest
a great
Health.
story. That's a great
Yeah.
story, and I'm sure you can't cover it all.
No,
and there's so
a lot
many
in
more,
between.
There's so many more things along the way that just perfectly aligned for you to get here.
Right.
It's funny you said King's Daughter. that's another place people don't really know very well down here, but my son was born at King's Daughter in Brookhaven.
Oh, wow.
So
We just keep having all these little connections. I love
right.
it. I love it.
So, I was going to ask what led you into healthcare, but it sounds like healthcare kind of found you.
It did kind of find me, but, speaking of King's Daughters, when I was in Greenville, I think something that really impacted me, that hospital was started by a circle of 10 women.
Wow.
Years ago, if you really read the history, there were all these different groups of the King's Daughters Circle. And the original women who actually started the hospital in Greenville, they started taking care of people on the riverbanks of the Mississippi River. And when I was there, I was working at the hospital, but there was an older lady. The circle still existed, and they still owned the hospital at the time. Now it's the Delta Health System, and so it's different. But anyway, I was asked to be a member, and what an honor. But I think that just is something that stayed with me because I saw the important work that women do. And how those women came together so many years ago, and I felt like, hey, I can, carry something on from that, from the lessons that they taught. So, so it's really, really interesting, history, and I think that drove me even more to healthcare.
So women is a big inspiration for you. And you actually, Spirit of Women, is that what it's called? That's what I thought. So
that's right.
That's your baby, correct?
Yes, we started Spirit of Women in 2004, and it's still going today. It's a lot of turns along the way because now it's a lot more about meeting women where they are. We used to hold a lot of events, but women have gotten busier. COVID changed our world. We never went back, to be exactly the same. So I think that really changed things. And so now, we would love to pop up at a mahjong get together or a pickleball, get together, meet women where they are, but still put the importance of their health in front of them. But Spirit of Women is something that is a great program because it's all about women taking care of themselves, because if they don't, they won't be there to take care of everyone else.
Yeah. So I was going to ask the heart and the mission of Spirit of Women, but we're gonna stay on that just a little bit longer because it is so important. Can you share what being a part of Spirit of Women looks like for an average woman that doesn't know anything about it?
Well, like I said, I think women neglect themselves. We are that central point, in the family. We're the go-to. We're trying to schedule children's appointments, and maybe a husband, maybe a parent that you find yourself all of a sudden you're the caretaker, for even more than your just immediate family. Because we have people aging, and so the woman is kind of the center of that, doing everything. So really, Spirit of Women is about, saying, hey, do remember yourself. Take responsibility for your health, and don't forget these screenings. Go to your annual checkups. Go have a mammogram. But one thing that we realized, a woman does not want to go hear a lecture about having a hysterectomy.
We do
not
not have the time to go listen to
you don't
lecture.
have the time, and you don't want to hear it, right? It's a little bit, personal. You'll have those conversations with your physician. But we brought something to the forefront called health-utainment. And what that means is we incorporate your health, but we do it with things that you have fun, that women have fun doing. Maybe they love gardening. Maybe they love fashion. Maybe they love cooking. It's all of these different programs that we've had, decorating. It's a fun element, but having the subtle reminders of, hey, don't forget, those things that you should be doing to take care of yourself. So it's a really neat concept.
That's wonderful. That is wonderful. So let's switch gears a little bit and talk about women in leadership. You are a pillar of the community as a woman in leadership at one of our largest health systems in the state, I would guess. Yes. Can you share a little bit about leadership and what that has meant to you, and what, when you think about leadership, what do you think a good leader, what kind of qualities do you strive to have in order to be a good, effective leader?
Well, I do believe that you do lead by example.
Mm-hmm.
I really am fortunate, I feel, in my journey that I started as a coordinator worked my way to a director,
Yeah.
worked my way to a vice president. If I would not have done those things, I wouldn't have the understanding that I do of the employees and what they deal with, what they go through, what they think. So I've tried to lead by example. I didn't want anyone to ever think I would ask them to do something I would not. So I led with that. But also, to have character and integrity, to be honest, to be transparent, and to listen. I've learned so much. I learn every day. I don't think we should ever stop learning. And I think with leadership and the younger generation coming forward, I hope that they will learn things, from us and the path that we've paved, especially for women, because I can tell you it's not always an easy path. But I hope that, I've led with, like I said, integrity. I've respect people and, I've shown kindness. I hope that that's something that people see in me, and that at the end of it all, that, there's heart there.
Yeah.
And I'm there, my heart is in it.
Well, I can confidently say it is. I have not known you very long, but it's inspiring to me. And getting to know you, as of lately has just been a joy. And as a 33-year-old leader who has a similar story, I actually started working in nursing homes.
Okay.
It's inspiring to know that, it's possible.
That's right.
And the hard work pays off for women. We may have to work a little harder sometimes, but it really does. It really does. It's possible.
Yeah. Oh, it's definitely
inspiring.
possible. And I have so many young women who've reached out to me, in the past. Can I just come and sit down and talk with you and visit and, hear your story, give me a little bit of advice. And I'm always happy to do that, and I enjoy that. And one thing that I've tried to instill in my girls, especially if they go the career path, my oldest daughter's now a stay-at-home mom, and her career path hasn't been the same as mine. But I always tell my girls, when you start a job, you go into an organization, don't go in thinking you know everything.
Right.
Respect those people around you and learn from them. And then one day you'll be the one that people are learning from. But never go in thinking you know everything, because you don't. We learn every day.
And I've always kind of lived by, and I don't know who originally said this or where I got it from. May have been a dream. But you never want to be the smartest in the room.
That's right.
And sometimes it's a little intimidating, especially when you're younger. Kind of have a little bit of imposter syndrome. Sometimes I do.
Yes.
But it's good to not be the smartest in the room.
Yes, and it's okay, because that's why you have teams. Everything that has been accomplished in my career has not been because of me. It's been because of a team coming together, for a common cause and moving it forward. And so, you're never going to know everything, and that's why you surround yourself with good people who have expertise maybe that you don't necessarily have, and they can drive those pieces that you need, because a good leader can see the end goal, right? Mm-hmm. But it's getting there, and so you've got to be a motivator and an encourager, and so surround yourself with good people. I've been so blessed to work with so many amazing people, talented people. And I think it's also a turnoff if someone thinks they know everything.
It is. You're right. You're exactly right.
I don't think we like that. No matter what level you are, I don't think that you like that, because I fully believe, like I said, we're learning every day.
And being a good leader maybe has nothing to do with having all the answers.
No. I mean, I think leaders have to have a certain humility about them. One thing that's very important to me is that someone be genuine and authentic. I think that you can see that immediately. When I connect with people, I can read that pretty quickly.
Yeah.
Is this person really genuine and sincere, and is their heart in the right place, or is this maybe just to climb a ladder to get to the next level? Yeah, raise some funds.
That's a big one.
Yeah, that's a big one. We're all hit up with
That's
that,
right?
But I've always told my girls, be the real deal. So
I love that.
I hope if someone says, "What did your mom always say to you?" that one day they'll say, "She told me to be the real deal." And what I mean by that is, go out, and if you're helping someone, be sincere in that. Be genuine. Be real.
Wow. Well, I do have this question too, and this is kind of along the same lines, but eventually it'll be time for you to have a legacy at Forrest General, and I would love to know what you would hope that would be for the generation that's upcoming at Forrest Health.
Wow, that's hard.
I know.
That's really hard.
And I think maybe, what I gather from your answer about leadership is that we've covered, what's important to you. So that I would assume that those would be the things you'd hope people would remember. But
right. I think I would love it to be that I left an imprint on someone's heart. That they felt, that I was genuine and sincere. My job has not always been easy, and I've had to make a lot of hard decisions, difficult decisions. I'm sure that there were people who went, well, I don't agree with that, or why did they do this? And that's hard in leadership because you it's not just, butterflies and rainbows every day, right? It's hard work.
Leadership is hard work.
It is hard. And, but like I said, I have the heart for it. I wanted to have a job where I got up every day thinking I was making a difference for someone. And that has really echoed to me because of the stories I hear. People call me or write me a thank you note. And that's what's so important. I don't touch patients every day,
right?
But I'm making decisions or doing things that has an impact on that, and I take that very seriously. But I hope that I left an imprint, like I said, of kindness, of being genuine, being real, and I hope that I gave a lot of people some opportunities. I've hired a lot of women that I think are very talented and have bright futures ahead. And I hope that I was just one of those steps. But leadership to me is not going to be when I'm gone one day,
right.
Oh, look what Millie did. It's going to be how did those that I worked with lead after I was gone.
Yeah.
That's, to me, a real leader. It's not about all the accolades for ourselves.
I love that. And I'm sure you're on your way to having that. So let's talk a little bit about what Forrest Health has going on right now. Any special initiatives, any special campaigns? What is on the forefront for Forrest Health right now?
Well, we did grow into a system, as you
You
had
did.
Forrest General as the mothership, and then of course we expanded to Forrest Health and became, a true health system, which I think is so important because maybe people don't always realize we have 6, outlying rural, smaller hospitals that are part of Forrest Health. We have an orthopedic institute. We have Pine Grove, that's our behavioral health. So really that system, that we're very proud of. And care doesn't end, when people leave the hospital. We have so many programs that really transition people, whether that be, a skilled nursing unit that they may need next, or a swing bed, or they may need home care, or they may need hospice, or our Asbury Hospice House that's available, palliative care. There's so many things that we continue, beyond just when they're an inpatient. And so with that extends to the community because we try to be everything that we can be to everybody. But as you and I know, one organization can't be everything, right? So that really leads into our community initiatives, our partnerships that we value so greatly. Children, our schools are so important that we get to these young children early enough to educate them on their health.
That's right.
The importance of taking care of their health now. I had an older lady say to me one day, she said, Millie, what you do in your 20s, that's how you're going to be in your 30s. What you do in your 30s, that's what's going to impact your 40s, And she took me through and I said, you're exactly right.
I've never thought about that.
And it's true.
It's a little perspective for you.
Will you benefit or will you have had some habits that that impact you as you age? So I think that we've always supported a lot of things in the community, but we really want to collaborate because there are resources again that maybe we don't provide, but through a partnership and by collaborating, we can support each other and reach more people because I think that's the biggest thing. Try to reach as many people as possible and make a difference for those people. So That's a big part of, going beyond our walls.
And I totally understand. And I've already gathered that Forrest Health, Forrest General is generally always willing to partner if it's going to be for the greater good of the community about anything.
Right.
In any way that they can. And you're right. I'm one person at the chamber. You're one hospital.
Right.
You can't get them all. And but there's ways to leverage the other organizations, partner together, come together. You can get a lot done. Can get a lot done. Can you tell me about a time when you've actually seen partnership in action for a wonderful result? What's something that you've done in the past that you were really just proud of, partnership-wise?
There have been a lot. There really have been a lot. I mean, I think we've done so much with education around heart disease, which is, the number one killer. I mean, our partnership with American Heart Association. One thing that's very dear to me with cancer care, I'm very passionate about cancer patients and the care that they receive. And, we saw that there are a lot of cancer patients that have difficulty getting to their treatments because they don't have the means for transportation, for gas money, and those things. So our employees at the Cancer Center came up with an idea, Fuel the Fight.
Wow.
And they started a run and a walk that has now occurring annually. And they've raised all this money for gas cards. And, of course, there's criteria. Wow. It goes through the Greater Pine Belt Foundation. There's a way that we distribute those, but that just really, warmed my heart because there was a story one time someone told me about a patient who actually had an empty coffee can at a gas station, asking for donations in order to raise enough funds to get to his cancer treatment. That stayed with me for years, and so I'm very passionate about that. I've lost some people very close to me to cancer. And, but, cancer and heart disease, those are two big things that face, our state, our counties.
Yeah.
And so I'm very passionate about those things. So proud of those efforts. And like we said, the women, I had a Spirit of Women event one time, and a lady stood up and she said, I just want you to know, because of coming to a program and hearing about the warning signs that are different for a woman that might be experiencing a heart attack, I had a heart attack, but I remembered that message, and and I was in tears. I mean, it's amazing when you hear the stories and it has made an impact.
And in that scenario, maybe she was the only one that remembered,
That's right.
But it probably saved her life.
That's right.
Wow.
Yeah.
Wow. I love. Everyone deserves health care.
Yes.
I just
very much.
The gas card is just ingenious. It's just genius.
Yeah. Well,
to help people
it's a
get
need.
to.
There's a need. We do a community health needs assessment every 3 years.
That's right.
To really look at the needs. And I'm proud that we didn't just do a 3-year assessment and let it sit on the shelf for 3 years. We have a community partnership committee group that has come together where we bring community organizations as well as Forrest Health together to talk about the different resources, the things we can do, how can we, like I said, get into the schools. So that stays active. They meet quarterly and discuss those things, and that's something I'm real proud of too.
So we're not just taking the assessments for data purposes.
That's right.
Just to see the trends. We're actually putting the assessment into action to try and
to make a difference.
Make a difference.
That's right.
with the things that are going on. I think that's wonderful.
And to understand the needs, because needs are ongoing. Something that may come in a community health needs assessment for 3 years, and then you do another one in 3 years. I know some things like Alzheimer's, has really come to the forefront. Our, infant mortality rates in the state is something that Dr. Edney, with the Mississippi State Department of Health is focused on. So, there's all these new things that pop up that people bring to your attention. Like, I know there's a need here, and that's so important that we understand that, so that when patients are coming to us, they fall into some of those categories of those needs. And you hear a lot now about equality and health equity. Equality, we can all maybe have access to the same cancer care, right? The service is there, but the way you may be able to go to your appointments, as I described, someone else has
May
a
not have the
transportation
means.
barrier and they don't have the means. So even though you have access, how we do have access can very much differ what our social needs are.
I would have loved to have seen the health assessment during COVID. I'm sure that the needs were totally different than what we were used to.
Very much. It's like one more Zoom meeting,
Yeah.
Yes.
Do you feel like we're on a good trend since COVID? Do you think that things are looking up?
I think so. Healthcare, we're always challenged in healthcare. AI is huge and coming onto the scene. And I think that, used appropriately, that's going to be great. Mm-hmm. You've got to, I went to a conference recently and someone said, well, some AI may not take your job, but someone who knows AI might if you don't.
That's right. That's
so
right.
I think that was a good way to put it.
Better learn how to use it.
I think, funding is always a challenge. Year to year, we're waiting to see how that's going to be impacted. But I do think, we really, of course, during COVID, staffing got really difficult. So many of, your clinical personnel, they were traveling. And so it made it really hard to staff.
I remember.
But I do think we have definitely seen that, turn around. And we do so much we're so blessed with the universities, the community colleges that we have, the programs that they are really that pipeline of that, the staff that
healthcare
you need
workers.
of healthcare workers. And so I think that, I think it's all very positive.
That's wonderful. That's wonderful. Okay, well, Star Spangled Celebration is coming up, and we have recently had a discussion about what we want that to look like this year, partnership wise. And as far as I know, and as of late, Forrest Health has just been generous with their sponsorship of the music production and the stage. But this year, we wanted to add a little bit of flair to the partnership. So why don't you go ahead and share a little bit about your vision with that, what you want it to look like?
Well, yes, we had a great conversation the other day, didn't we? I love brainstorming. That's one thing I've always loved about my job. I have this creativity piece that has to be met, and so I love coming up with new ideas and being creative. And yes, when we talked about community outreach and the importance of connecting with the community, we came up with red, white, and blue, and a healthy you. So I think that's going to be
it's
a
so
hit.
Cute. I love it.
We've still got some brainstorming to do.
I haven't told you, but I actually already have a few ideas.
Oh, great.
I think we're on the right track.
Yeah, but we talked about, when someone attends a community event, they're there for that event and fun. And what a great celebration, 250 years of, America and celebrating that. So people are going to be there to have fun and fireworks, and they don't want a lot of pamphlets or brochures or things like that. And we know that, but we still want to get that message out about your health. And if it's just get up and move a little bit, we might have them dancing to some music, right? I think that we even talked about recognizing maybe one of our veterans who is key. I have not told him that yet.
We need to do that.
I won't reveal that yet. I have a meeting with him next week, so I'll tell him that. But I'm very excited to get that message out, and I can't wait to hear your ideas that you've thought on since we met.
And I do. I have a shared love for health. I've been in the health industry for almost a decade now, and I still do it, surprisingly, with 2 kids in the chamber and everything else. It's just a piece of me that I can't let go. I love coaching people, so I just love this. I think it's going to be wonderful. It is the semi-quincentennial of America, so it's a huge deal. And, even though Star Spangled is a tradition that we've done for many years, I think that adding these extra elements is just going to make it even more special to the special year. So
I totally agree. And we only get one body, right? That's the blessing that we get. So we need to take care of it. I'm not trying to preach to a choir because I am not always the best. Like I said,
that's usually how it is.
I use myself as an example when I'm trying to encourage women. I'm like, look, I am not, I don't have it all together, and I don't have everything, exactly right either, but it's that you're working towards it.
That's
you know what I mean? That you've got it at the forefront and you're always thinking about it. And I think we've just got to keep putting it out there in front of people. But
and small bites
yeah,
can finish the apple.
Yeah.
Just one little thing at a time.
Right. I see so many people, though, walking now, and that just warms my heart.
It's a big deal.
Especially now that the weather's nicer. I see, they're out even more, but see a lot of women walking, and that's a great thing. So.
Yeah. Well, Millie, thank you so much for coming.
Yes,
I've enjoyed this.
it.
The very first podcast for the Petal Area Chamber of Commerce, and I couldn't think of a more perfect fit for that than you. And I just thank you so much for coming.
Well, thank you, and thank you for having me. I've thoroughly enjoyed it.
Yeah.
I appreciate you doing this very much.